all just shifting me around and nobody's getting anywhere.
A Tulsa woman with a debilitating illness is now fighting for her medication. She hasn't been able to get a prescription for nearly a year now.
She says what's worse is she's been slapped with a massive bill that she just can't afford to pay. 2 Works for You's Erin Conrad went to work for her in a story only on 2.
Tommy Whitehurst has lived her life to the fullest, riding motorcycles, enjoying friends and family, and working full-time in construction until a few years ago, when everything came to a screeching halt.
Your life changes real quick in a blink of an eye. You don't realize how, important things are and how grateful you need to be. I'm sorry.
Tommy was diagnosed with MS, or multiple sclerosis, back in 2014. In 2017, her condition got worse.
I didn't know I'd have to retire early. I didn't know that I would have to park my motorcycle and never ride it again,
MS impacts everything from mobility to memory. Tommy takes medication to slow the progression of the disease, but hasn't since January because she believes there's been a mix-up over her prescription billing. She has Medicaid, Medicare, and a supplemental plan to cover her bills. She tells us every year her coverage changes providers, which is what happened back in January. Her medication on automatic renewal and her copay typically a few dollars.
But when you open up a bill and you go $4,000.
Her problem, the old insurance company and the new both say it's the other's responsibility to pay that big bill.
Do you know how many paychecks that would be for me?
Tommy is on disability and lives on $855 a month. She's contacted her previous provider, current provider, and the pharmacy, but can't get a straight answer on how to get the bill resolved so that she can get her medication. That's why she called 2 Works for You.
Sometimes I get confused trying to talk on the phone to them, and it's hard to just get it right.
As she's working to fix the billing issue, we were able to help her apply for her medication another way, through her doctor.
So as long as you get the application, you'll most likely be able to get her actual physical medication here shortly.
Right. That's right.
Okay, all right. Well, I appreciate that. Thank you very much.
You know medical billing issues crop up all of the time, and there are steps that you can take right now to get medication through other sources if you find yourself in a bind. Tulsa County has a pharmacy through social services that can sometimes provide medications to low-income residents. You can also go directly to the maker of the medication to see if they have a low or reduced cost program. Also, ask your doctor about ways, besides your insurance, to get your medication if you find yourself in a similar situation. As for Tommy, we're continuing to follow her efforts to figure out the bill, and we will put these tips on our website, KJRH.com. Just search medical billing issues. Erin Conrad, 2 Works for You.
A simple nose spray is saving veterans' lives from the opioid epidemic. Naloxone, also known as Narcan, is given to veterans on high-dose opiates to reduce the risk of death. Veterans are twice as likely to die from accidental overdose. A pharmacist with the Eastern Oklahoma VA healthcare system says the medicine should be quickly administered when opioid patients are found unconscious.
You'll want to administer this medication if you know that they're on opiates. And what will happen is it will kick the opiates they have on board